Let's talk about epidurals for labor pain control. An epidural is a form of pain control during your birth process. A small tube is inserted into your back and medicine goes through it to help keep your pain down. This tube is inserted by an anesthesia provider. They help patients with pain. Let's discuss the epidural, the steps, and what to expect. First, your anesthesia provider will ask you to get in the correct position. This means putting your chin to your chest and tucking in your bottom. This position helps them find the right places where they're going to place their epidural. When you are in this position, either sitting or lying on your side, the anesthesia provider can easily get to your epidural space, a small space just outside the layer that surrounds your spinal cord. As you can see, the correct position opens the spaces in your spine to easily get to the epidural space. Next, to help lower the risk for infection, your provider will put on a hat and mask, wash their hands, and put on packaged gloves called sterile gloves. Next, with your spine still in the correct position, your provider will scrub your back to clean it. It will feel cold and wet. After they've cleaned the area, they will inject medicine right under the skin to numb the area before they place the needle that will help them get to the epidural space. This is known as an epidural needle. Once they place the epidural needle, which is hollow like a straw, they will be asking to make sure that it's in the correct spot. Please make sure to let your provider know whether you feel pressure on one side more than the other, or if you feel it equally on both sides. This will help your provider know if it's in the correct spot. You should be numb and only feel pressure. If you feel pain, let your provider know and they will pause for a short moment to inject more numbing medicine. The provider is trying to access the epidural space. This is a small space just outside the layer that surrounds your spinal cord, filled with fat, vessels, and nerve endings. When the epidural needle reaches the correct spot, your provider will insert a very thin plastic tube through the center of the hollow needle. They'll then remove the epidural needle, leaving just the small thin tube in place. This tube is where your medication will go through, and it's a soft plastic tube that should not hurt once it's in place. With a small tube going from the inside of your back to the outside, the anesthesia provider will give you some medicine through the tube. This should take about 10 to 25 minutes to begin working to make sure that the epidural is in the right place and working correctly. They will stay with you to ensure it's safe. Once the tube is in the correct place, your provider will put a large bandage over it to keep it in place and may place the tubing over your shoulder along with some tape. For some, they may hook up your epidural catheter to a pump, which will allow you to decide when you need more medicine. You don't have to worry about getting too much because your anesthesia provider will set up the pump so that you can only receive the safe amount within the hour. Your button should only be pressed by you. You may be wondering, what things should I be worried about? Sometimes epidurals can cause your blood pressure to drop, which can be dangerous for you and your baby. However, your anesthesia provider will give you fluids through the IV in your arm to help reduce the risk of any drops in your blood pressure or injury to the baby. Another thing that can happen is called a post-dural puncture headache. This headache worsens with sitting or standing and only gets better when lying flat. The headache tends to be worse in the first 24 hours after the epidural. This kind of headache comes from the epidural needle going a little bit too far in the incorrect place, which can cause fluid to move in a place where it shouldn't. However, there's only about a 1 to 6% chance that this will happen. Another thing that can happen is called an epidural hematoma. This is where a sac of blood in the epidural space starts to grow and can result in a need for prompt treatment. It's very unlikely for this to happen, but it can cause painful back pain, and if you are concerned, you should let your provider know right away. You might be worried about nerve damage to your back or spine from the epidural. However, It is very rare for nerve damage to happen. In fact, the largest study of over 700,000 people receiving epidurals found that only 1 in 20,000 had long-term nerve damage lasting more than 6 months. And in pregnant women who had labor pain control with epidurals, only 1 in 80,000 had long-term nerve damage. So now you may be wondering, what are the most common side effects? Well, besides headaches, most of the side effects come from the medicine your anesthesia provider gives you. This includes itching, as well as nausea or vomiting, and dizziness from low blood pressure. Epidurals are the only form of medication pain control that can help with most pain in birth and have few side effects for mom and baby. Many are happy with epidurals because it allows moms to participate in delivery more comfortably and bond with their baby after delivery. With the epidural in place, you will have pain relief, but you will still be able to feel pressure, such as the contractions for labor. This is normal. Epidurals have also not been shown to slow down labor. In fact, they can be safely placed even up until the point right before the mother starts to push. After labor pain is over and the baby has been delivered, the epidural can be easily and safely removed. This should be a pain-free process. However, you may have bruising from the epidural needle for the next few weeks. This is normal. Some women might get back pain from the labor process alone after delivery, not just because of the epidural. Are there any other reasons why epidurals can be helpful? Remember how we talked about how epidurals allow providers to give extra medicine? If you need to have a C-section, a surgery where your baby is taken out for any reason for the safety of you or your baby, an epidural is a great way to allow you to stay awake for the procedure but be numb from the waist down so that you can participate in the birth of your child. Why is pain control so crucial for labor pain? Less pain can decrease mom's anxiety and help them to have better blood flow and oxygen to breathe, which means better blood flow and oxygen to baby. This can assist with contractions and protect mom and baby from extra stress. The goal is to make you comfortable and make your pain manageable. With an epidural, you will still feel pressure, but it is the aim to reach your comfort level. Labor and birth are beautiful, natural, and individual experiences for each person. Not everyone chooses or needs pain control with medicine. No matter your choice, your anesthesia team is there to support you. Please remember to always talk to your healthcare provider for medical advice specific to your needs.